really are the safety net healthcare provider in San Diego, serving, roughly close to 230,000 people every year. People outside of our communities don't really know what we do. They don't understand the kind of cultural understanding that's required, the complexity of the cases that we're looking at. We literally have providers who, in Keds and scrubs, in a hoodie or a rain jacket, depending on the
Wow.
weather, and they are walking through encampments to say, what do you need? You're going to have a culture no matter what. It's just whether one that you're in control of or one that you're reacting to. Your only job really is to be yourself. And there's literally no one else on this planet who can do that job for you. What's one thing I can do today that's a step in the right direction? I might be able to not change it, immediately. It won't be overnight, but I can take one step in the right direction.
Welcome back to the episode here on the Heart and Hustle podcast. Our next guest, Meredith, how are you doing today, madam?
I'm great. Thank you. How are you?
Good. I actually ask you this. So I always start off with madam, but then someone says, don't say madam. There's actually a bad context behind madam. Not that I know it, but do you?
I don't have a reaction to that, but I was also raised in Texas, so madam and ma'am. People tease me. I live in San Diego now, and people will be like, I'm not a ma'am. Don't call me ma'am." I'm like, "My mama raised me right." And
That's it.
I say sir and ma'am. So,
I'm trying to get my daughter to say ma'am and sir because yes, or yes, dad, or something, because, it is the respect. And is that a down south thing, you think?
I mean, I think so. It's definitely a southern thing. Maybe other places, but for sure in the South, it is expected that you speak to your elders as sir and ma'am. And even people like my age, when I would wait tables, I would say, yes, ma'am. And people would look at me funny. And I'm like, it's a
Out of
sign of
respect.
respect. Yeah.
Yeah, yeah, out of respect. Well, I appreciate you taking the time here. You're in San Diego. What is the organization you're representing today?
I work for Family Health Centers of San Diego. So we're a community health clinic. We're one of the largest, one of the top 10 in the entire country. So we really are the safety net healthcare provider in San Diego, serving, roughly close to 230,000 people every year. We have a special mission to serve people who are medically underserved, who are medically vulnerable, who are underrepresented, who are low income. 92% of our patients are low income. So we really
Wow.
have a very target mission to provide meaningful, high quality, outstanding health care that's very dignity forward to people, regardless of their ability to pay or their insurance status.
What gets you into the line of work? I mean, when you could probably be doing so many other different things, you're here for a reason. What's the why?
My why is, I fell in love with philanthropy. So, what I do is raise funds. I advocate for the mission of the organization. I fell into that by accident when I was
Okay.
living in Texas about, 30 years ago, I guess 20 years ago. And why I brought that to community healthcare is really, I'd been in higher education. I also worked at a biomedical research institute. I'm passionate about science and the way that that can improve the quality of human life. This particular organization is so close to the mission, is so close to the impact, and people don't people outside of our communities don't really know what we do. They don't understand the kind of cultural understanding that's required, the complexity of the cases that we're looking at, the deep understanding of our communities that's required to really do a good job, to really meet our community's needs. And to me, that challenge of bringing people and organizations that maybe are far outside of our communities. They're in much wealthier communities. They have never needed a community health clinic, so they don't really understand it. Um, Bringing them close to our mission and helping them understand the importance of safety net healthcare organizations. I think that's a really fun challenge.
I was talking to an organization here in Florida, and one of the things she mentioned, just because you talk about the different groups, right? The groups that may not need it just because they're kind of well off.
Yep.
During pandemic time, even those people, she says she's seen people driving these nice fancy cars that would have to come to a food pantry, that would have to, make their way out, but they didn't know these places existed. But a
Right.
lot of the times, these resources are not just there for those that need it today. It's there for everyone, even those that may not need it because they're here today. Tomorrow they can be here.
Right.
Did you experience that during the pandemic? Did you see that shift, or I don't know if you were already there in San Diego, or were you still in Texas?
So I was in San Diego, but I was working at the Biomedical Research Institute.
Got it.
So my connection to the pandemic was really unique because I literally worked with a scientist who was one of the people who made the Moderna vaccine possible. He's listed in the patent for
Wow.
it. I worked with infectious disease experts who had tracked where, the earliest influenza outbreaks where Zika outbreaks were, and he would show kind of a heat map
Yeah.
of where it, and then you track it, and it really was along. If you look at kind of the 1812, influenza, and then Zika, in modern times, you could see that the spread was very, very tied now to airline routes,
Uh-huh,
to air
uh-huh.
travel routes.
Yep.
And he would talk about kind of how that spread. So I had heard these presentations, I had seen this research. There was a lot of talk, never about coronavirus. We really thought it
Yep.
would be another intense influenza that would be our next pandemic. So, it was very, very personal at the time.
Yep.
Working with researchers who this is their life's work, and then being getting an upfront seat to
Yep.
see how important vaccines are, how important research is, how critical it was in the pandemic to getting things moving quickly, getting vaccines ready for the public very quickly, was very personal. But I know my organization, Family Health Centers of San Diego, were one of the first ones to host very big vaccine clinics. And so you had very wealthy people
Yeah.
who were showing up, in the lines, to get a vaccine because that was unfortunately the great equalizer.
Yeah.
Everyone was really looking for the vaccines. Everyone was, waiting in long lines and desperate to be vaccinated when it first became possible. And Family Health Centers of San Diego was on the front lines of delivering it to the county.
Love that. So, kind of go back into, all right, you guys are providing for the community. People may not know about the services. Do you think it's a marketing thing? Is it the way that we communicate as organizations? I mean, we're in a space where digital is everything, right? Digital front door, whether it's your social media, whether it's getting somebody on a SMS. Like, what do you think hinders organizations like yours to be able to tell the community, this is what we do, this is what we offer?
I mean, I think it's a couple of things for my organization and many nonprofits. It's humility. And I kind of tease the organization. I'm like, it's not always a good thing. Like we historically have been extremely focused on reaching our potential patients. We
Mm.
want the people that need us to know where to come for services. We have 29 clinics. We have 21 behavioral health clinics, so primary care clinics, behavioral health clinics. We have mobile units. We have a mobile mammography unit that
Wow.
will bring mammograms and cervical cancer screenings out into the community. I think the people that we have, and we have very, very good reputations in our communities. I think where our patients need us, we are very well known, and all of our kind of quote unquote marketing has really been focused exclusively on being sure that the people who need us know where to find us, that they know
Mhm.
where they can come to get a mammogram, that they know where they can come for good dental care, they know where they can come for, glaucoma testing, a vision appointment, those critical preventative care and urgent care. But we haven't reached beyond our communities. And part of
Mm.
that is it's just not in our nature to toot our own horn. We're very roll up our sleeves and figure out what the community needs and then figure out how to meet those needs. And that's a noble, beautiful, kind of aspect of that's in our DNA. But unfortunately, that means, if you're familiar with San Diego, Del Mar, for example, is north of La Jolla. It's a very wealthy, right on the beach community, really cute little town. They have no idea who we are in Del Mar because we haven't focused any of our kind of marketing, our social media, or anything to really tell the stories of what we do because again, we're very concerned that our patients, know where to go to get care. So it's been a little bit to our detriment, unfortunately.
Yeah.
And the people who are in San Diego who have means and capacity and who have a real heart, for helping those with others, who understand San Diego is, there's a real haves and have nots, in this county. There are areas of tremendous concentrations of wealth, and there are areas of tremendous need. We've got sleep shelter, sleep safe sites, extensive shelters. We've got a growing unhoused population. There are areas of tremendous need, and so the drastic difference in San Diego is rather stark, and people that live here know that. But we haven't really reached beyond our communities historically.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. You mentioned so many different services that you guys offer. How many people are you guys seeing on a yearly basis? I know 2025 just ended. Did you have a about estimate of how many people were served?
230,000 individuals. So that's not for visits. We have over 1 million visits because often they come, for multiple appointments. There's
Yeah,
obviously different needs, but in terms of like unduplicated individuals, it's over 230,000.
that's a lot. You guys are doing
It's
a
a
lot
lot.
of yeah, yeah, yeah. And you just mentioned we're barely tapping the surface because there's
Hmm.
still so much opportunity to be quite frank. And how do you get there? Can imagine there's a lot of creative control, a lot of creative ideas that come with that. And how do we continue to reach the masses, right? Where
Absolutely. Well, and one example would be our street medicine team. We literally have providers who, in keds and scrubs, and a hoodie or a rain jacket, depending on the
wow,
weather, because it doesn't rain a lot in San Diego, but it can be drizzly. It can be drizzly. But, rain or shine, they're out with a case manager, potentially a health navigator, a substance abuse counselor, is on call, and they are walking through encampments to say, what do you need? Can we help you with
wow,
your medication? We'll help with transportation. We'll take them to a clinic. We'll get their meds refilled. We'll make sure that because now the requirements for Medi-Cal and Medicare are going, they're more stringent. Now you have to renew twice a year. So there's people who qualify who might not renew because they don't have they don't get the information or they don't have a good address for where, they're getting their
yeah.
paperwork to renew. And so we're out there helping them renew. We're out there making sure that they can still access, their benefits and keep their meds. And one of the things that that team does is partner with, SDPD because they have a homeless outreach team. It's called HOT for the acronym.
Yep.
They work with the HOT team so that, because basically what we were seeing was we would be, our street medicine team would be in these encampments and there might be an infection, a disease, an illness going around, and we've got it close to being controlled. We're going twice a week to these encampments. We're making sure everybody's on their meds. We've got it sort of close to being under control. And then for legitimate reasons, they have a job to do, but businesses complain, they're blocking entrances, so they'll come and do a sweep of the encampment, which means you've now
Mm,
scattered all of these individuals with something that's
yeah,
infectious and thrown away their meds. Because basically they come in and sweep everything and everything gets tossed. And
yeah.
now it's a public health issue. And so our team basically reached out to them and said, we're not trying to stop you from doing your job, but can you give us a heads up before you do this? Because we can go in and we can talk to them about how do we find you? How do you find us? Where's a clinic you could come in if you wanted to? Where is your kind of backup plan? Can we connect you with, the homeless task force, the regional task force on homelessness for, to get a bed somewhere or path to get a bed somewhere? There's a lot of organizations that do great work in San Diego and we can kind of help try to create some stability in infectious diseases. And we found SDPD to be very, very willing to work with us. And so now they give us a
That's
heads
good.
up and we'll go
Yeah.
in, with these other partners and try to get people in beds or try to get, make sure that they have their meds, make sure that they know where to come find us to get refills on the meds if they do get thrown away. So that's just one of those really innovative. I like the street medicine team as an example of innovation and really understanding the community as well as our mobile mammography unit.
What,
You know,
what is your day to day? I mean, there's so many different pieces going on. What does your day to day look like?
There's no 2 days that are alike. It's one of the reasons I love my work. Sometimes it's going to a networking event and talking to kind of the movers and shakers, of San Diego and telling the stories. Sometimes it's sitting down with an individual or funding, a philanthropic organization and talking through what a gift opportunity or a proposal might look like. Sometimes it's partnering, last week I went with one of our therapists for our concentrated mental health program, which is a really special high needs program. And we went and sat and got a tour at a local farm that basically produces, I would misquote it if I tried to say how much vegetables, but they produce a ton of fresh vegetables. And their mission is to basically feed people who can't, afford it.
Wow.
And so they have farmers markets where they basically like you pay what you can. It's incredible, but what we wanted to know is can we partner and create maybe
Yeah.
some joint proposals or collaborations so that our folks in the concentrated mental health program can get some fresh produce, because a lot of them qualify for SNAP or EBT benefits. They can go to a food pantry, but they really struggle to get fresh produce.
Yeah.
A lot of them don't drive, and there's not places walkable in their communities where they can afford healthier foods.
Okay, I got a question for you actually. Now that I think about what you just mentioned, the mental health. Do you think that for those that are watching, what we eat changes the mind or helps with the mind,
I
right? So
think
when you talk
food is
about
medicine.
fresh produce, and I say that because I have a friend. He distills his own water, right? He
Hmm.
doesn't drink out of a bottle, and his saying is like, "Hey, when I gave up drinking bottled water or faucet water, my health changed tremendously." Now, this is also someone that experienced 10 years of addiction. And he
Hmm.
just meant, and so he always makes fun of us. He's like, I'll never not shop at Whole Foods because Walmart is low quality. So I go to Walmart, by the way. So whoever's
Sure.
watching, Walmart's okay. But I think his mindset may be there because of his past. Is like, I want to get the best in me so I can get the best out of me. You
Absolutely. I
agree?
mean, I believe food is medicine. I have garden beds. My wife and I are growing our own vegetables.
Love it.
I want to know things don't have chemicals and pesticides. I mean, I will say I am not one of the people who has any issue with genetically modified foods.
Hmm.
I actually think it's the way that, because I've been on the science side of it,
Hmm.
I think how we partner science with agriculture is the only way that we're staying ahead of climate change, because we're producing vegetables that have higher resistance to, we're seeing increased salt in our water, so higher salinity
Hmm.
in our rain. We're now producing vegetables that can withstand that. We're now producing vegetables that can withstand, greater temperatures of heat, longer periods of drought. So I don't have an issue with GMOs. I have an issue with chemicals. I'm not going to put chemicals in my body. I don't want pesticides. I think the research on what things are worth buying organic is really interesting. It doesn't always have to be everything, but the things that are like root vegetables, they're going to soak up more of those chemicals in the dirt, and so they're really worth splurging. I am not a Whole Foods for everything kind of person, but I definitely am a you get your best nutrition not from supplements but from your food.
Never. Okay.
Drinking a
I don't know.
green drink isn't going to cut it. Eat a broccoli.
It's like you're talking to me, okay? I am the person that says, I would go get a green smoothie with the kale and spinach, everything in it. Because, matter of fact, my wife yesterday made Brussels sprouts. They smell disgusting and they are disgusting, actually. But yesterday,
I
she put a little
love
bit of
Brussels
bacon
sprouts.
in it. She put a little feta cheese in it. And my wife is that person. If you love me, you try it. I'm like, babe, you're not gonna
She's not
do
wrong.
this to me. I tried it. I'm like, yeah, it's just as gross. But there's vegetables that I eat, but broccolis, I can't stand it. I have a neighbor that eats them like they're candy. So yeah, you were talking to me when you said, don't just drink that green drink. Take your vegetables. I ask you, I don't know if you gave us the role. What is your current role today?
I'm the vice president of philanthropy.
Oh, okay, love it, love it, love it. And I want to kind of tap into the garden bed in just a bit, but as a leader, we are told to not told, but we've kind of learned how to pour into others through our lives, right? But
Hmm.
sometimes we forget how to pour into ourselves. And I always say there's that thing that we do outside of the work that we do on a 9 to 5 or every single day that allows us to find peace.
Yeah.
Mine's is plants. I have about 50 plants throughout my house, all around here. But it seems like you may also be in that space. So you said garden beds. Are you outside a lot? Is that your peace? Is that your therapy to kind of fill your cup a little bit?
It is, and sometimes I get really busy and I forget. And then I walk outside, or someone will say, let's take a walk and talk meeting. And I'm like, oh, yeah, my soul needed this. If I can just get some fresh air, get a little sunshine on my face,
Yeah.
it is really, really good for my mental health. So, garden beds, I enjoy my fingers in the dirt. I really like plants, but there's something really satisfying about. I also hate grocery stores. I just hate grocery shopping.
Okay.
It's a thing I will avoid at all.
Are you ordering online and picking up?
Yes, or having it just delivered. It's awful. I don't know why I've suddenly, I think COVID changed this. I would avoid the
Yeah.
grocery store and I just never went back to enjoying it.
Wow.
But I can go and find fresh produce right in my, garden for dinner,
That is
and that
so
is very
good.
satisfying.
That is
I
so good.
avoid the grocery store and I control the quality, which I appreciate.
I am not there yet, however, and really because of time, but I do want to get to that space of producing my own crops. I got 50 plus plants, and I've obviously propagated some of these plants from a big plant to little plants, XYZ. So I'm like, I could do vegetables and fruits, right? It's just I'm a little extra, so I want to build a greenhouse because I
Sure.
also have these damn possums that like to eat my stuff. Or we
Yeah.
have these biggest. This is kind of off topic, but these things are like grasshoppers. I think they're called lubers or something like that. They're like
Hmm.
beautiful. They look really nice, black and yellow. But during the summertime, they'll come and eat every single thing. They've eaten my pineapples, my tomatoes. So I haven't physically got to, and I think I want to do more off ground as well. It probably helps out a little bit to get them off
Yeah.
ground. But yeah, I love that you're creating your own vegetables. Not creating, you're growing your own vegetables because you're not sitting here, scientist or anything, but
Right.
you're growing your own vegetables. I love that. What I want to also kind of go back even further to your personal. Was this something you've always thought of doing? Growing up, out of high school, did you always think I'm doing philanthropy work? I'm going to be giving. I know you said you were an educator, but where else did you see yourself before you get here?
So I really thought I would go into higher ed and academia. That was how I found fundraising. Was I
Mhm.
was getting my master's in literature with a kind of a focus on women's studies. I wanted to study women's voices in literature, both from a character perspective and authors.
Okay.
And while I'd worked for a long time, I think like 8 years in communications at Southwest Airlines. And I was in the executive office by then and learned so much when you talk about leadership. I mean, I was like a baby when I started working at Southwest Airlines. It was my first real job. And so I took for granted that, like, this is how every organization is. I learned so much about culture, about leadership, really lessons that I still think of and use every day today. But I was deciding to leave there. I wanted to do something little closer to the heart. And so I got a job at the university because my ex was also going into academia. I think he was in his PhD program at the time, and I was getting my master's and thought, I'm going to go on, I'm going to get my PhD, and I'm going to, you know, I mean, I pictured something very romantic, where of course, it would be like a Robin Williams movie, and everyone would just soak up all of this wisdom, and we would sit around in a circle, talking about, how literature touched our lives. Very cheesy, very unrealistic, but that was my vision. I've always been a voracious reader and really thought that was my path. And so I got a job at the university in the advancement department. And I really thought this is just to get the benefits of, almost free tuition for me and my dependent. So it basically cut our tuition bill down, immediately. And I never left philanthropy. I just fell in love with it. I didn't really even know that advancement meant it was the fundraising department. I
Oh
just,
my
it said they had communications. The woman who
god.
hired me, we're still very, very good friends. She's one of my dearest friends and will always be someone that I look up to. But she'd seen I had a background at Southwest Airlines and that I had a background in communications. And she really thought that would be interesting to bring that experience to, it was managing the phone-a-thon. It was managing a group of students who made
Wow.
calls to alumni and fundraised. And I fell in love with it. And I never left.
I'll tell you what, I love the airline industry.
Yeah.
I've, I've got
I
to get
like
to the
those free
airline
flights too.
industry.
My dad reminds me all the time
Oh,
that he doesn't get to fly for free anymore.
yeah. I did 5 years with JetBlue,
Oh,
and
fantastic.
I loved it. And to be quite frank, the only reason I took the job was the free flight benefits. However, I started in 2019, 2020 pandemic happens. You're not flying anywhere. So I didn't get to
Right.
do a lot of flying and but it was a great opportunity. To what you mentioned, a lot of great leaders. I
Yeah.
loved the way that it was just kind of the organization, especially at that level. I
Yeah.
really felt that they cared not just about their people, but about their brand. I
Hmm.
still remember their values: caring, passion, integrity, safety, fun was some of the
Yeah.
values they had. And I love those because I felt like I lived all those values, right? And they gave me so much opportunity. But just like yourself, I found that I needed to know my worth,
Hmm.
and I was felt like I was boxed in, because at the end of the day, we're just an employee to another corporation. Um, but the nonprofit world, especially the nonprofit world, allows you to be a little bit of everything. And as you
Yeah.
mentioned, not every day is the same. And when you start to realize that, while JetBlue was great money for me, the passion and purpose was completely elsewhere.
Yeah.
And I noticed that when they sent me out I was a facilitator, so I would teach like all the curriculum for those that were
Sure.
on the phones. And we started to hire out in South Africa, so we were pretty much hiring our replacements.
Yeah.
So I went out there and for 3 weeks, and I realized, okay, I'm teaching JetBlue content, but the people loved Ephraim. They loved who I was as a person and the way that I was able to just care for them and never see them any differently, right?
Yeah.
And I realized, like, man, I'm I'm great at speaking. I'm great at just people. I'm not just great at the airline, and that's where I kind of said, you know what? They gave me a great uh, package. It was a time where they hired all these people. Now
Sure.
they needed to cut. Hey, we're giving opt outs because we don't want to let nobody go. So,
Sure.
however many years you've been here, we'll give you that many years to fly for free. I was already wanting to leave. I said, wait a minute. I'm leaving with flight benefits? I know you would
Well,
appreciate that,
threaten me with
right?
a good time.
Exactly. I said I'm out of here, and I haven't looked back. But there was so much that I learned. I never thought I'd be a facilitator. I was just working from home, picking up phones, and then pandemic kind of changed the whole trajectory of that was. And I appreciate the airline. I feel like there was so much that people don't understand about airline itself. So
It's
when people
true.
are sitting here at an airport mad because it's sunny here, what do you mean the flight is delayed? Yeah, but a flight is coming from somewhere else where maybe it's snowstorming over there. You know what I mean?
Yeah.
So what is one of the biggest things you learned from the airline industry? You say?
I mean, my friends joke, I still speak in airport codes. But because it was Southwest Airlines and because, I got to work directly with Herb Kelleher, with Colleen Barrett, with Gary Kelly once he stepped in as the CEO. I got to work with the people who
Wow.
founded the airline. So you don't get closer to the culture, of Southwest Airlines. I learned a lot about the importance of consistency and communication, and really that the ways that you create culture are very intentional, and very thoughtful. And you really have to, you're going to have a culture no matter what. It's just whether one that you're in control of or one that you're reacting to. And
Hmm.
so, from a leader, in the ways that I've built my team, I've always talked to my team really proactively about here's our values, here's how we do things, here's the nuance of how we do things, here's how we interact, here's our expectations of each other and our expectations of ourselves. And I learned all of that at Southwest Airlines.
Love
Actually,
that.
I joke with the friends that I had when I worked there. There's no other industry, in my opinion, that's quite as exciting. um, you always, especially if you're working, close to the mission.
Yep.
We got to do a fake. I got to be a fake reporter, with
Okay.
Gary Kelly when he was brand new as CEO, and we were like testing him as like, a press conference, and it's just really fun and exciting. And you
Yeah,
have
you had a good
days where
time.
everything goes wrong. I worked for an airline at nine on 9/11.
Wow.
Um, and obviously that was tragic, but it also made me feel important. I was at the center of something that felt really important and
Yeah.
exciting in that way. And it took me a few years to sort of get over that, like, where's the next excitement? Where's the next crisis I can lead into? When you get
Yeah.
to be in the crisis war room with the executive office post 9/11, there's not a lot that feels quite the same. So,
Yeah. You mentioned a couple of things. You mentioned culture. You
mhm.
mentioned leadership. Good leadership creates good culture. And I was just talking to a leader right before you, and she says, "Hey, sorry that I had to kind of dress down a little bit. Something was happening, so whatever, they dressed down. I said, actually, I appreciate a good leader that dresses down and doesn't feel they always have to be in a suit and tie. Because to me, they understand that it's not about what you wear, it's who you are and how you treat others. How important is culture and leadership to you being in various locations now?
It's extremely important. I mean, I think it's kind of everything. Right now, I lead teams that interact with the public, and they interact with the public, people who are giving of themselves, time, talent, or treasure,
Yep.
whether they're, volunteering to give their time, whether they're giving philanthropic dollars. These are gifts. And I do think that we don't call it customer service, in the nonprofit world, we call it donor relations, but it is the same. It is about respecting people. It is about appreciating what they bring, remembering to say thank you, remembering to bring them in. You're not just talking at people, you're really remembering to listen. All of those are values. If I don't create a culture that says these are the expectations of how we engage, I am not concerned about a tie, but I am concerned about being really responsive and being true to your word and interacting with integrity. And if that is as simple as, when we follow up this meeting, I'm going to send you that information that you asked for that I didn't know off the spot. I'm going to do it. My
Yeah.
word is good. I think trust is critical in the nonprofit space. There's probably not an industry where you would say it's not critical, but obviously I feel really passionate,
Mhm.
that when people are giving of themselves in any way, whether it's their time or their hard earned money, that we show a tremendous amount of, integrity and trustworthiness for that. And that comes from culture.
Yep. Um, it trickles down, right? Like you're a good leader, you start to see it at the people at the front line. And
Yeah.
that's usually like I had a friend. I love business. I've happened to work in the food, the aviation, the retail, and what I know is if you have great people, you have a great. If you have a great manager, you have great people. Great people mean a great store. And I've been able to take stores and turn them around, not because I'm just good at food or good at it. It was good at leadership. I
Yeah.
was good at working side by side with people and not just always having to micromanage somebody. Like I
Right.
always feel like I don't want to micromanage anybody. We're all the same individuals. I just happen to be in the seat, but in reality, we're all humans, right?
Hmm.
You can take the seat at any time. I'm willing to give it to you. And one of the things that you mentioned along the lines was values. And I think there's things that we live by as leaders. I won't put you at too much, but three words, just words that you can think of that kind of showcase who you are as a leader. What are those three words that you live by?
Authenticity.
Uh-huh.
I'm very myself in every situation. My team
Love that.
knows. I also empowering. Information, is, knowledge is power. Share it, give it away. It's a way that you can empower your people, and it doesn't cost you a dime.
Yep.
And I would say integrity.
Okay. I got to go back to that first one. Being
Yeah.
authentic. As a woman in this space in leadership, how hard was that? And when did you learn it? When did you realize you were comfortable in being authentically you? Because not everyone could be authentically them because they feel like they're
Yeah.
part of a corporation or whatever. But you, since I've got on the call since first time earlier today, I can see, yeah, this is you. But where did that come from?
So I'll tell a quick story. I was at a dinner recently, with some colleagues that I hadn't seen in a really long time, and the person who was hosting this dinner asked all of us to kind of talk about things that you'd learned from your childhood, lessons learned, things that you would tell your younger self. And so I was raised in a Mormon, very, very traditional Mormon family. And I grew up genuinely believing that there was just something wrong about me, that I was
Mm.
bad. And really, when I look back, I was not subversive. I wasn't getting into trouble. I wasn't lying. I was a really good kid. I followed the rules, but I was really opinionated. I was really vocal. I was really outspoken and outgoing. I was really competitive. I loved sports. I loved, to like go play basketball with the boys in the gym. None of those things are the model of the correct Mormon girl. I was supposed to be more submissive. I was supposed to be quieter. I was supposed to be meeker. And I just had a fire in me. I was always speaking up. I always, wanted to kind of debate or discuss. And then I would catch myself and I would feel shame. And it took me a really long time to realize that who I was actually just fine. There was not one way to be a woman, there was not one model to be a woman. And I think I would have never had the confidence to lead those teams if I was still feeling ashamed of the things that are actually really good qualities about me.
Mm-hmm. Mm-hmm.
And so I kind of told this story and said I would tell that girl sooner that who she is just fine. That
Yeah.
continue to be a good person, continue to be honest, and to care about other people's feelings. But it's okay to be opinionated. It's okay, to want to be the top of the class. It's okay to be, outgoing, to have a big personality. And afterwards, one of my former colleagues, who was now in a leadership role, but was in a more junior role when we worked together, she came up to me and she said, it was so surprising to hear you talk about that. And she said, I don't want to make things awkward, but I have to tell you, you were that for me.
Wow.
I would look around and I didn't see women in leadership positions, or if I did, I saw them modeling kind of how a man did it. And she said, it surprised me to learn that that was ever hard for you, because ever since I've known you, I've really admired how you just show up as yourself.
Mm-hmm.
And that means also trusting my team with my vulnerabilities. Being authentic means being a well-rounded person who can admit there are things I'm good at and there are things I'm not good at. And I build teams to shore up my weaknesses. And then I lean on them to show up
Yep.
and lead, in those spaces. And I think that requires not just self awareness, but embracing,
Mm-hmm.
of your whole self. And so for me, that's what authenticity means. And I did not learn it easily. I did not learn it quickly. I actually think the intention was for me to turn out quite different, and it just did not work. Thank goodness my mom still loves me.
Very similar. I think at my 30s, I'm 36 now, and probably my 30s where I really learned confidence. And even though I was saying this, know your worth all the time, I don't think that I knew my worth, right? I was telling other people to know their worth, but I didn't think I knew mine.
Yeah.
And it was everything that you mentioned, right? Just trauma in my life that I was still thinking I owed somebody something. I was thinking that maybe I talked too much, that maybe I wasn't the smartest kid in the room. All these things that we grow up, but that's what really makes us, right?
Hmm.
And then when you think about it, you're so much more grateful. Like,
Yep.
man, I'm so happy that I didn't change who I was. And I actually heard that from someone. I was remember one time complaining about, man, I do this all the time and I don't get it back and, reciprocate about XYZ. And the guy says, don't ever change who you are for somebody. That's who you are,
Yep.
right? And when we talk about even the people that you serve, is don't change who you are. You're such a great person, and something in your life today may not be going well. The mental is not working the way that it should, but that's not the end all be all, right? At some point, you
Right.
can grab that pencil and tell your story, because for a long time we have people tell our stories and tell us who we are and how we
Yep.
should act and all this other stuff. And in reality, we're not bad people. Yes, could we tweak it? Yes. Do we take
Sure.
L's? L's? Yes. But you know what? While they're losses, they're also great lessons in our lives. And I can imagine you taking some L's and
Oh, for
seeing a
sure.
lot of the great lessons that come from it, right, Meredith? What is that
Yeah.
one?
Well, I mean, my previous CEO, who was a chemist, always
Yeah,
said, I learned so much more from my failures than I do from my wins.
I
And
agree.
it is so true that if you don't have failures, number one, you're not that interesting. We get interesting from our failures, but you also improve. That's where you really like lean into, okay, I've got lessons learned. The wins are in the rear view and they're great to have, but where we really stretch and grow, is from our failures.
Yeah.
It's one of the things, just, getting back to like being who you are. It's one of the things I tell my stepdaughter all the time. My ex's kiddo, she's 15 now, and I would always tell her, like, your only job really is to be yourself, and there's literally no one else on this planet who can do that job for you.
Yeah.
So like, she was playing soccer at the time, and I would say, don't, do you get out of position and go play someone else's position? And she's like, no. I'm like, that's the thing. No one, your position is your job. You got to keep your eye on your prize, because no one else can play that position. That's your position to play.
Yeah.
I
That is
do like
true.
a good sports metaphor.
You did say you were into sports. You did say that. Um, I ask you as we start to wrap things out, if people want more information on what you guys are doing in your communities, what's the website? Where can people find? Is it you? Is there socials they can maybe tap into?
Absolutely. FHCSD is our acronym, so it's Family Health Centers of San Diego. FHCSD.org is our website. We have quarterly events. If you're in San Diego, we host the most incredible event. It's in its 40th year. It's called Spirit of the Barrio. Barrio Logan is the original roots of Family Health Centers of San Diego. Our founder was an abuela who basically realized that this community desperately needed health care and literally chained herself to the doors for 8 days when they tried to demolish the community building. And that is really the roots. And so, in her honor, she used to really like make homemade tamales to invite people to come hear about the mission. And she knew if she fed them that they would come, and she could really like kind
Yeah,
of
everyone loves
preach
food.
about the importance in supporting this organization and get people tied to their health care. So we host down in Barrio Logan. We host Spirit of the Barrio quarterly. You can find that information on our website. The tickets are $25. The tamales remain delicious. You'll be glad to know they are not homemade by me. Um, we now partner with a phenomenal company, mom and pop restaurant here in San Diego that makes them. We've always got really thoughtful speakers. We did healthcare for the homeless recently and really talked about how we tackle as a community those. We've got women's health coming up. We're going to have one on mental health that's going to be outstanding. I think we're also going to do one on refugee populations and our work with the justice involved folks and how we help people transition from being incarcerated. So,
I
some
love it.
really meaty, interesting topics. And I always say I want people to leave well fed, informed, and inspired.
Well, listen, Meredith, thank you so much for your time. And I leave you with this last question. There's people that's watching, and I think that when we talk about authentic conversations, one thing can change somebody's trajectory in their life. If you can talk to someone that may be struggling and whatever may you guys serve a lot so much different individuals, but someone that's struggling is looking for a resource, what do you say to them?
I mean, I'm a big believer in therapy. I really think, saying it out loud, it takes away its power. So I would say it out loud to a friend, say it out loud to a professional, but start talking about it. I really do think there's just tremendous power
Hmm.
in speaking our problems aloud because sometimes they rattle around in our heads and they seem much, much bigger than they are. And then my second one is make a to do list. What's one
Yeah.
thing I can do today that's a step in the right
Hmm.
direction? I might be able to not change it, immediately. It won't be overnight, but I can take one step in the right direction.
Yeah. Well, Meredith, I appreciate your time. Great conversation. Guys, if you guys want to continue to tap in, make sure you guys find them out in San Diego. If you're in San Diego, get the tamales, first of all, and let me know how it tastes. But also go find them and figure out the resources that they're doing in your own community. Spread the word, subscribe, like, comment. I'm Efrain. This is Meredith. We'll catch you guys on the next one. Latest.